truest sense. And it's an honor to have you in the White House, and go to it, Bobby.
Thank you, Mr. President. I want to start by thanking you, Mr. President, for declaring war on chronic disease in this country. This is something no American president has ever done. If we want to solve the chronic disease crisis, we have to tackle obesity. Obesity is the #1 driver of chronic disease. 50% of our adult population are obese or overweight, and it drives about 50% of healthcare costs in this country. Diabetes, cardiac diseases, we are going to see a decline because of this historic agreement. We're going to see a decline in costs, but also, more importantly, in the afflictions themselves. President Trump is the friend of the forgotten American. Obesity is a disease of poverty, overwhelmingly. And these drugs have only been available for people who have wealth. At one point, the majority of prescriptions, the highest concentration of prescriptions in this country, was the Upper West Side of Manhattan. And what about the people who live in rural areas, who live in food deserts? What about the people in urban areas who live in food deserts and are suffering from obesity and are locked into that system where they can only get ultra-processed foods, which are aggravating the problem? This will be a lifesaver to them. It's not a panacea. It's not a silver bullet. President Trump has also instructed us to address and end the root causes of chronic disease, and we're doing that. We're about to release dietary guidelines that are going to change the food culture in this country. They're going to change the kind of food the military gets. They're going to change the kind of food that our children get. We're releasing those in December. The Presidential Council for Physical Fitness is going to get more Americans into, particularly our children, into physical activity so that we can attack the root causes of this. But in the meantime, there's nothing more important than we can do than lower this price. As I said, it is the #1 cost of all drugs. This is the biggest drug in our country. That's why this is the most important of all the MFN announcements we've made. This is going to have the biggest impact on the American people. All Americans, even those who are not on Medicaid and Medicare, are going to be able to get the same price for their drugs, for their GLP drugs. This happened because of the vision of David Ricks, of Mike Dustar, and the other people, and the people on our team who figured out a way to align the interests of the shareholders of their company with the health of the American public. And it is a momentous accomplishment. It took months and months of negotiations. And I had a wonderful conversation with Mike Dustar about his experience, and he thanked me for the caliber of people who are on our side of the negotiating team. Chris Klump, who walked away from $1 billion business in order to join this administration, Emma Hernandez, David Brooks, and of course, Dr. Oz and Marty McCary, who made this happen. They saw that this could be a win-win situation, that this was not a zero-sum game. The Biden administration tried to solve this problem unsuccessfully, I might add, by throwing $40 billion at it. And they were able to achieve an agreement that will actually create savings for the American public. So we're making all of this available at a savings, and that's because the price of diabetes prescriptions is also going to drop. And the savings that we get from that are now going to make it available to people who do not have diabetes. People who have a BMI of 27 and above, or pre-diabetic, or have heart disease risk, they will be able to get it, but everybody will be able to get this drug, and it's going to change. We will lose, the American public, because of this agreement, will lose 125 million pounds by this time next year. It is going to have dramatic effects on human health in this country. And I want to thank President Trump for his leadership. He said that I'd gotten a lot done as HHS Secretary, but almost none of that is due to my ability. It's because I'm surrounded by people who are smarter than me, who are more able than me, and those people came into the administration because they were inspired by President Trump. People like Chris Klump are here because they see this.
You think they are smarter than you and
Yeah.
more able? No.
Believe me, they're a lot smarter than I am.
Why don't you take that job?
He doesn't really mean that he's being modest, I promise you, but
It is true, unfortunately.
it's a beautiful thing.
But I want to thank you, Mr. President, because you've made me a success here by allowing me to attract these extraordinary people. And I want to again thank David Ricks, who we've been in this Oval Office again and again. You keep saying he's the smartest guy in industry, that he could talk a dog off a meat truck. But it came to the table, and Mike Newstart told me, he
Well,
said,
you convinced people for 20 years that it was okay for Europe to pay $10 and for America to pay $140. That's why they make 45, 50 million a year. He did. Finally, I said, I've had it, right?
You did.
He did. But anybody could do that, they're entitled. But now it's down to what it should be.
and Mike Newstart told me what a pleasure it was to negotiate with people who were smart, who had common sense, who were able to put themselves in his position and hammer out this deal that is good for everybody. And it's great for the American public. I want to close again by just saying that this is a tool in the toolkit. It is not a silver bullet. It is an arrow in our quiver. It will allow a lot of people who are locked into high-risk obesity to finally lose weight, to reset, and then start doing the kind of things that will address the root causes of obesity. So I want to thank these extraordinary CEOs for sticking with us on this, for allowing us to make this happen. Mike Newstart said to me, he said, we've known we've had to do this for many years. We just haven't been able to get over the edge, and that this, President Trump's order, his executive order, was a catalyst to do something that we always knew needed to be done. So again, thank you for your vision, for your commitment, and thank you to all the CEOs and all of my team for making this historic agreement happen.
Bobby, you haven't changed your view on Tylenol for women that are pregnant?
No, as I said,
There were some false reports out about Tylenol that Bobby changed his view. I don't think he's changed his view.
I'm not going to change until the science changes, and the science does not look like it's changing. It's getting stronger and stronger. Every day, what we recommend is that pregnant mothers, talk to their physicians, that the mothers of small kids talk to their physicians, and we've advised the physicians to reduce the thresholds and to reduce the amount of Tylenol that they give to children as much as possible, and only use it when it's absolutely critical.
Thank you.
So we're going to go through some of the deal points, but it does make itself clear that the real stake here is the forgotten man. President Trump, I believe you won the election because you remember the forgotten man. You speak to them, they hear you, they listen to you, and he connects well because he actually does things that materially change their lives. Secretary Kennedy spoke